As a trans person, I was very well trained not to reveal that you're trans to any doctor, to avoid that, because before the Affordable Care Act was passed, trans people could be discriminated against by insurance companies based on any little whiff of transgender identity. And
because it was considered a pre-existing condition, right?
Exactly, and it would be something that anything that was even could possibly be connected to your endocrine system, which is, I don't know, kind of everything, right? That or reproductive system, which is again a lot of things, could be considered connected to your trans care, right? So if I'm on hormone therapy and I take testosterone, and I have a problem with my ovaries, they can make a connection that's because I'm on this other care, and so I created it, or I'm trying to get rid of my ovaries because I just want trans care, and they don't cover trans care, and so they're just going to reject it immediately. And because of that, then any marker that you're trans on your charts could possibly just kick back all this stuff in insurance.
Hey there, and welcome to In Sickness and in Health, a podcast about chronic illness, disability, medical traumas, and everyday uncomfortable healthcare experiences. My name is Cara Gale. I'm not a doctor or a medical professional. I'm just a person and a patient who really wants to talk about this stuff more. Nothing said on this show should ever be considered medical advice. If you're experiencing a medical issue, please seek qualified medical help. I know the system sucks, but I wish you a lot of luck. Every person is different, even within disease groups, so none of my guests should ever be regarded as official representatives or spokespersons for their conditions. Please respect their very personal choices, and unless they ask for it, please don't make suggestions about treatments or lifestyle changes. Unsolicited medical advice is never not annoying. In today's episode, Leigh Thompson talks about the hurdles to diagnosis as a trans person with complex health issues, healthcare insecurity, getting around the city with mobility issues, and navigating society with invisible disabilities. In the bonus episode, we talk intersectionality, the spectrum of ability and access, disclosure, hormones, and the potential for allyship between the trans and disability communities. Not because we're the same, but because we have many shared issues that affect each community in similar ways. One place for natural allyship between the two communities that we didn't even get a chance to talk about is bathroom access. When we think about bathroom access for people with disabilities, we usually think about wheelchair-accessible stalls, but there's so much more to it. For one example, people with conditions that cause frequent pooping or peeing or vomiting, or even just so that you can take your medication in peace. In many public places, it can be hard to find a bathroom when you need it, but bathroom access is a human right. With increasing legislation discriminating against trans individuals, such as the recent high-profile laws passed by the North Carolina and Mississippi legislatures, the situation of bathroom access for trans and gender nonconforming individuals has gone from bad to worse. While those two laws are getting a lot of attention, there's been a sharp uptick in laws discriminating against trans individuals across the United States, most of which actually violate federal law. These laws are positioned as ways to keep people safe from being attacked in bathrooms, but have no basis in reality. It is trans people who are most often assaulted while simply trying to use a restroom, among other things, and not the other way around. Like I said, bathroom access is a human right, and I can summon little more to say about these ridiculous laws than a big old pile of fuck that shit. So we need to fight back and fight for bathroom access for all people, regardless of gender or ability or how often they need to poop. As always, find links to learn more about some of the things we talk about in today's episode in the show notes. Check us out at insicknesspod.com for other resources and more, and find us on social media at insicknesspod. You can find Leigh online at sleighthompson.com and on Twitter at sleighthompson. If you can, take a moment to subscribe, rate, and review us on iTunes, which helps other people find the show. And I hope you enjoyed this episode.
I know that I've had experiences that date back to middle school, but really a lot of my stuff is retrospective. So I really started to struggle with mobility in 2000 and the beginning of 2007. And that's right when I was moving into the house that I currently live in, which is 4 stories, brownstone, and moving into the 3rd and 4th floor, and mostly had to move that stuff by myself. And all that physical up and down over the course of multiple days, I found myself waking up on January 1st and having really limited mobility. And had
Great
never...
way to start the new year.
Exactly, right? Big, beautiful new house, really excited to be there, and not really being able to move up and down the stairs. That was, I ended up having to cancel going into work for a couple of days. And my then boyfriend ran to Duane Reade and bought me a cane. And that was the first time that I ever really considered that I might need some mobility device. But for some reason, it had been something that I'd actually even thought of before, because there had been comments that my mom had arthritis, really bad arthritis. And I knew that I had arthritis. Like, I could feel the ache in my joints at times. And so I knew that was happening. But it was never, like, debilitating. It was an annoyance. But this point in 2007, I realized, this is bad. And it continued to plague me at times and settle into my spine, where there would be times where my back would go out because the swelling in my joints would cause misalignment. It would pinch a nerve. Everything would flare up. All the muscles would try to support and respond to it. And so then it would just kind of trade sides back and forth. And that kind of continued on for a while. And then this weird thing happened. I found a partner. I fell in love, and my partner Charlie moved in with me. And with that, I started to realize that the daily annoyances of living in my body were not normal, in that I was actually having to explain them to somebody on a daily basis.
Yeah.
Somebody who wasn't experiencing these same challenges with food, challenges with breathing, challenges with mobility. And I'd already talked to him about challenges with mobility early on, but not these other things. And so as I continued to explain and kind of asterisk every single day, that I started realizing, wait, this isn't normal, right? This isn't what other people are experiencing with their bodies. And that's when I started trying to figure out what are some of these challenges that I'm coming with. So multiply, the things that include the arthritis was this very clear disability moment. But I've also always struggled with my digestion. I've always struggled with respiratory stuff. And I never thought of any of them as being connected with each other. I also had all these other weird things that just felt like immune system things, becoming immune to medicines really, really quickly. Becoming immune to deodorant. I would use a deodorant.
That happens to me. It drives me nuts.
Really? Yeah, I would have to change my deodorant every day. And I'd have 7 deodorants, and I would just use one day, and the next day I'd have to use a different one.
That's one way to do it.
That's just to keep cycling, so that way I never would be able to just get immune to one of them until eventually one would stop working, and I'd throw that one out, and then because of capitalism and mass marketing, there's always a new one around the bend that I could stick under my pits. And so there were just these weird things that just kept popping up. And at some point in time, I started to think about what if they were connected? What if they were interrelated? And I don't even know how that really happened. Actually I do. It's when I started when I looked up the difference between a sinus infection, an upper respiratory infection, and bronchitis. Because I'd had them so many times, I used them interchangeably. And I was just I have a sinus infection. Yeah, actually, almost all of those times I had bronchitis. Anytime I say upper respiratory infection, it's actually me coughing big chunks of things out of my lungs. Yeah. That's not upper respiratory. That's middle and lower respiratory. That's actually in my lungs. So when I was looking that up, I learned that people who experience a lot of acid reflux are more likely to get bronchitis. Because of the wear of the esophageal lining from the acid, it's going to cause the possibility for infection, and that's when I started realizing those could possibly be connected. And then I started the pieces just started to come together a little bit more of all of this feels like my body attacking itself. That these are over responses to things that are not that significant. Unfortunately for me, the story kind of dwindles out there. because what I mostly know is maintenance, management, hiding or not hiding certain types of physical needs, or what my experience is, whether or not I actually out myself as a person with disabilities or not. What I really know is that the medical community does not feel like it's been something that's been supportive of me for most of my life, and so it hasn't been a place where I've gone to seek answers, only when absolutely, it's a place that I've gone for necessity, but not for clarity. And so now that these more recent revelations have come to be, I know that I need to continue the process towards actual diagnosis, but that is not something that I've actually achieved yet.
Yeah, I don't blame you.
Yeah. So that's kind of at least that part of the story. The other aspect when it comes to necessarily the medical community in me is that I'm a trans person, which means I was assigned female at birth, but live as a man and have for the last decade plus. And that was going to the doctor for medical need, going and navigating the medical community in order to receive access to hormone therapy and eventually surgery and continued hormone therapy, which has a very specific type of care that is very regimented, which means consistent going to a doctor. I was lucky in New York City to be able to go to Callan Lord Community Health Care Center, which is an LGBT clinic in the city. And that clinic made it possible for me to see somebody who understood trans patients, who was really well versed in continuing or providing hormone therapy, and was somebody I actually really liked seeing. And so I saw him for multiple years, particularly around that. When I started having other joint problems, he also supported me there. Long story short, he moved to LA not that long ago, and it's been hard to find somebody to fill his shoes. Callan Lord, when that person was there, was very helpful for me, but honestly, not every physician at Callan Lord is that guy.
Right.
So even though they got a very good plan to try to support trans and queer people in New York City, their actual physicians aren't necessarily always the most caring, supportive doctors, period. Even though they're there to do good things,
right.
They're understaffed, overworked, and sometimes just in a rush, and it's hard to actually get to diagnosis and not just treatment of the immediate. And so
which is true of every medical setting.
I would assume so. Yeah. I mean, I would hope that there's these we're in New York City. There's money everywhere, right? Not everybody has it, but the people who do really have it.
Yeah, lots of it.
So there's boutique-y doctor things here where, but there are people who have some ridiculously serious money, and people who will do whatever the fuck they can for for getting a piece of that. Yeah. So I'm assuming that there's places where people can have hours to talk about every particular ailment, but when you get 15 minutes with a doctor,
yeah, forget it.
It's also a thing that, as a trans person, I was very well trained not to reveal that you're trans to any doctor, to avoid that, because before the Affordable Care Act was passed, trans people could be discriminated against by insurance companies based on any little whiff of transgender identity. And
because it was considered a pre-existing condition, right?
Exactly, and it would be something that anything that was even could possibly be connected to your endocrine system, which is kind of everything, right? That or reproductive system, which is again a lot of things, could be considered connected to your trans care, right? So if I'm on hormone therapy and I take testosterone, and I have a problem with my ovaries, they can make a connection that's because I'm on this other care, and so I created it, or I'm trying to get rid of my ovaries because I just want trans care, and they don't cover trans care, and so they're just going to reject it immediately. And because of that, then any marker that you're trans on your charts could possibly just kick back all this stuff in insurance. Another reason why Callan Lord was so good is because they would make certain that they would not mark that stuff in your charts. And so that stuff didn't go out there. But when you go to another doctor, you just never know. And so it was always a gamble.
Right.
What do I really need? Is it important enough that I may actually get this marked in my chart that could actually start fucking me over in terms of my insurance in the future? Is it something that's so important that could be is it so important that I could experience discrimination, bias and bigotry at a place where you're often most vulnerable? Do I want to experience that today or kind of ever? And so I, like most trans people, and then I would go to the doctor only when it was absolutely like a medical necessity, when I was super sick and was actually afraid for my existence. But rarely because of discomfort. And then lastly, I haven't had a consistent, for a number of years, I haven't had consistent employment. I've been a freelancer. I've been working for small organizations that don't provide health care, been unemployed. And in those periods of times, haven't had health care that has felt secure.
Right.
And growing up also in a position where healthcare wasn't secure, just was like stay away from the doctor as much as possible. Things like diagnosis at times seem like a luxury, especially when they're difficult. And the couple of times that I've actually tried to achieve diagnosis, the number of hoops I have to go through with the new doctor that I'm seeing, because the doctor's continually recycling when I'm going to this clinic, the doctor that doesn't stay there for a full year. So when I start the process again with a new doctor, they want to weed all the old stuff out all over again, which means I have to go to this specialist here, and I have to go to this specialist here, and I have to bring this bag of poop to this doctor here from my house on the train, which makes me wonder when I'm on the train, how many people are in there? How many people have you ridden with on the subway in New York City?
Secret bags of poop.
Secret bags of poop, because
or jugs of urine.
Exactly, because apparently that's a requirement. Is you have to go home and do this and bring it in.
Well, most people can't poop on command, so
I understand. I hear that, and I'd like it to be an option. But honestly, let me try. Let me see what I can do. Maybe I can stop by when I'm feeling particularly ready. Anyway, so the amount of hurdles to get towards diagnosis have just been really challenging for me. I'm hoping soon I can start again, mostly just to get, so I can say I have a thing. So I can say it's a thing, not just like an undiagnosed autoimmune thing, but actually say a name would be great. But I don't know, and perhaps have a treatment that's not symptom treatment, but something that's really a cure, maybe cure, but probably not. But something that just feel like is
addresses
more
the source,
a holistic,
of the issue.
But in the meantime, it's more about daily maintenance and how do you navigate the world when your body doesn't work the way that other people expect your body to work.
Yeah. You said when we were on the phone that you got the message repeatedly as growing up that getting a diagnosis would mean not having access to health care. So can you talk a little bit about that?
Yeah, so in relationship to that, my mom has had arthritis for most of her life. She marks it from the time she was 13 years old, teenager. And she, gets really swollen joints. Her feet swell up really big. And she always told me never get a diagnosis. My mom works in insurance. She works for a national insurance company. And she knows that insurance adjusters can, see pre-existing condition and deny coverage for things.
Or at least they used to be, potentially could again in the future.
Exactly, yes. Yeah. Thank you, ACA, and boo on anybody who's trying to remove the ACA. So it became this thing where it's like, when my joints were hurting, my mom would tell me, you have arthritis, I have arthritis, you likely have arthritis, that's what's happening. Never get diagnosed, because if you do, then it won't be covered on your insurance because it'll be listed as a pre-existing condition. Only get diagnosed if it's absolutely necessary. And so it became this avoidant tactic of saying, okay, never talk about this, never get it written down, because somebody's going to pour through this at some point in time, find that some doctor listed that you have arthritis, and say, we're not going to pay for all of these things. Which I still don't understand is how it was ever legal to do that.
Pregnancy was a pre-existing condition.
Exactly.
Like, are you serious?
Yeah. And it's like, okay, that's great. Still need help.
Yeah.
And that's your whole, like, that's the whole point. It's not just like what might happen. It's what's happening right this second. So I have no idea. I think it's the insurance model versus the healthcare model. Like, insurance is like, we will ensure that something won't eventually happen to you, and if it does, you will be taken care of. Healthcare is, we will make certain that everybody has healthcare.
Right.
And those are
very different things.
Exactly. They're different approaches that we use for the same thing, because we're talking about insurance as a pathway to healthcare.
Well, I mean, here in the U.S., it's inextricably linked.
Exactly.
You know, you can't talk about one without the other, which is unfortunate.
But if we were talking about healthcare and about equal access to healthcare, and not about, and like insurance companies were responsible for supporting that as the goal, then it would never be about restriction. It would be about everybody trying to provide, making that happen. But insurance is particularly about gambling. I mean, that's what it's.
Oh, absolutely.
It's about gambling. It's about risk.
I need to look into like life insurance more, because I don't understand how that model works. 100% of the people are going to die.
Yep.
You know, because the whole point is like everybody pays into this system. Most people won't need the services, and so that money goes to cover the services for the people who wind up needing it. But with life insurance, you're gonna die.
Yeah.
I don't understand how that
The
works.
idea is, when are you going to die?
Right.
So it's like, if I start paying into my life insurance policy now for like $100,000 policy, right? And I'm still paying that premium. If I die next year, like, this is so morbid. I win, right? Because or my family wins, because they get $100,000, but I probably only paid like $1,000 into that premium.
Right.
And which is probably even less than that, because probably only $10 a month for a $100,000 policy or something at my age. But if I pay on that for the next 50 years, insurance company can win, because they're paying out in a different way, and they're storing that money in some sort of savings and actually building, wealth off of it, et cetera, et cetera.
Yeah.
But it's still, like, it's this
Doesn't
weird
make any
gamble.
sense.
Yeah.
The other thing, I mean, with the Affordable Care Act, there had been built into the law a provision that everyone would need to get coverage, so that healthy people would, be paying into it. And then the Supreme Court struck down that provision. And now the insurance companies are like, oh my God, we're spending so much money. All of the people who now signed up for health insurance are costing us too much. But it's like, duh.
Yeah.
You were excluding them before. 1 in 2 Americans have a chronic health condition.
Wow, really?
Yeah.
I didn't know that was the number.
Yeah, 1 in 2 American adults. And that includes mental health and everything like that,
Sure.
which
That's
it
a lot
should.
of things.
But, acting surprised about this is ridiculous to me, because I'm like, people are sick, and they were completely barred from getting coverage before, and now that they can get coverage, they're going to, because they're sick.
Yeah.
So I don't know. Our whole system seems rather fundamentally unsustainable to me.
Yes. Yeah, I was going to use the term "fucked up," but unsustainable works too.
That also works.
Yeah, it's and that's the thing. It's like, for me, it's been. I've not like grown up with doctors in the family, so I can't say like I've known a lot of doctors, right? I've known some. But I don't know a lot of people who work, as doctors, so I don't have like a lot of people who like could help me put a humanizing face on what for me has been some very cold interactions with the human component of a very cold and antiquated system that continues to function to churn out really substandard care for most people.
Yeah.
I don't. It's not a system that I'm interested in continuing to throw myself in. And especially as somebody who has a condition that seems like it's at least rare enough that doctors aren't like, oh, well, clearly it's this when I walk in. And
you'd be surprised at how often they miss very obvious things.
And I would hope that that's the
case.
case.
But on the other hand, you're totally fucked if it's a rare condition.
Yeah, well, I'm saying it's like at least what had happened is like it's multiple symptomatic, right? It's like if I was just going in for arthritis, I'll say it's arthritis. But this is something that at least I'm, again, not a doctor by any means, myself, it's very clear for me, in the experience of my body, it's very clear that these things are linked in some way. And if that's the case, it's more challenging than just if it was one particular symptom that I was dealing with, or one particular smaller ailment that only came out with one symptom.
Because you have multiple body systems involved, and because our specialties are so siloed, it's impossible. I mean, I was seeing 6 different doctors in a single practice, and they couldn't even talk to each other. Like, it was helpful that they were all working off of the same medical record, but beyond that, what I thought was an ideal situation was just like the same as everywhere else.
Yeah,
just like really frustrating and disheartening.
Yeah, and it's like if you can't get like our bodies are all working together to churn out illness, or I guess other things are churning together, but it's all interconnected. The fact that the human, I don't know, it's all human components, I guess, but like the person component, like we can't be interacting with each other to figure this stuff out.
Right.
It's also funny that for me, and I'm certain, like doctors every day get people coming in, it's like, I'm certain, I read this thing on the internet, I'm certain that I have this health problem. And like, I can't tell you how many eye rolls I get when I tell people stuff about what's going on with me, especially when I continue to see new doctors again and again and again. But when people don't listen to a patient when they're telling you about their experience of their own body.
Right. They live here. They are the expert. Like, you might be the expert in medicine, but they are the expert in living inside of this body.
Exactly. Yeah. It's like I have, 37 years experience on my body. This person has 5 minutes experience on this body.
They probably don't even know my name without looking at the chart.
The last person I saw, oh my gosh, it was so infuriating. I went into this doctor and I was finally like, okay, I'm going to get to the bottom of this stuff. I'm going to get this taken care of, because I let it dwindle the last time because I was going through so many hoops and I got really frustrated. And now I've got this whole brand new doctor because that other person's not around anymore. And so I'm a whole new doctor, and I'm going to start again with this PCP and get to the bottom of these things. And so I go in because I'm experiencing some stuff, and I wanted to tell her about all the symptoms that I was dealing with, and that I wanted to get tested to see what the problems were, particularly around my digestion, because it was getting to the point where I was having difficulty eating anything. And fasting for multiple weeks at a time, and just feeling miserable. And so I went to this doctor, and I was telling her, well, I'm having this, these symptoms. I'm like, and I really want to talk to you about like these kind of 4 things. She's like, well, what do you need today?
Right.
For you to answer these questions first off. But she didn't tell me like, I can do this for you now because this is like an introductory visit, and then we'll schedule a visit for this other thing. She didn't tell me that, and that would have been helpful. But she just, when I told her that, like, I think I might have asthma, I have definitely other respiratory problems, I get bronchitis pretty consistently. She's like, well, a lot of people think that they have asthma.
Because a lot of people do.
It's like, well, thank you that a lot of people have that. Maybe they're right too.
Yeah.
Like, listen to me talking
especially,
to you about stuff.
In a major city where we know that asthma rates are sky high, like, there's no reason to assume that a person doesn't have asthma.
Exactly. And especially when I talk about like I was diagnosed with asthma in 6th grade.
Right. Especially when they have a diagnosis of asthma.
Yeah, and then I'm trying to explain to her like these other symptoms that I'm having, and she's continued to dismiss all of them and give me these eye rolls of like the person who's like either a hypochondriac or trying to self-diagnosis, and it was so frustrating. And then she gave me like the worst phone call that a healthcare practitioner could ever give somebody, where she told me, we're going to take some blood, we'll schedule another visit, I will only call you if something comes up, otherwise just assume everything's normal. Great. Of course, I get a phone call at like 8 o'clock at night.
That's not a good time to make that phone call.
When I'm at a bar, having a drink, and I see that I have a voice message, so I must have missed the call, and my friend's in the bathroom, so I'm like, I'll check it real quick. And the voice message goes something like this. Yeah, hi, Leigh, this is Dr. So-and-so. I just got your test results back, and you should call me as soon as you can.
Oh my God.
You should call me. I'm going to be here until 9. So, yeah, everything's fine. Everything's normal. I'm just like, are you fucking kidding me? You don't put a 30-second introduction to everything's fine.
Right.
When you give somebody...
that includes call me as soon as you can.
What the fuck? I'm like, that's like such a mind fuck, right? And it's so, and especially when I went in because I was worried about all of these things, to get a phone call where the person can't just get to everything's fine. I understand she's possibly overworked and could be like flipping for the paperwork because she made the phone call before she was ready to actually make the statement. Okay, I get it. Still shitty.
Yeah.
Still a shitty thing to do, right? Don't do that.
Right.
And then then I go back to the same doctor because I'm like, I'm trying to commit to staying to a doctor. I want to try to make this relationship work. I don't want to see a new person tomorrow. So I go to my next appointment with her and I sit down. I say, look, I just need to talk to you for a second. Like, can we just have a conversation? Because I felt like our last interaction was pretty cold, and I feel like you dismissed a lot of my worries. I didn't even talk to her about the phone call because I figured I can address one thing at a time.
Right.
And, that's how she wanted to treat me. That's how I'm going to treat her. It's like, we'll address one problem right now. And that's the way, like, you dismissed a lot of my concerns, and she shut down, and she's like, well, I answered that question. I answered that question. I'm like, okay, I hear you saying that you think you did. I'm telling you that I didn't feel that was answered. I'm telling you I didn't feel like you really were listening to me, and that it really is harmful for our relationship, and I really want to make this work. And I really want us to, for me to be able to become healthy in your care. And so maybe we could start off again, but in like a conversation, because, I'm a facilitator and that's the kind of work that I do.
Right.
And
let me guess.
It's like, yeah.
She hated that.
She gritted her teeth. And by the end of the visit, we kind of were moving forward in a way that felt like kind of a helpful, supportive, like moving directly. She was shaking when she was taking my blood pressure before. By the end, she seemed like a little calm and cool. And I thanked her multiple times for listening to me, and she's kind of like dismissed the thank yous. Okay, fine, whatever. But I'm going to thank her. Anyways, well, she agreed to do 3 things. Provide me with an inhaler, schedule or give me a referral to a pulmonologist, and give me a prescription for testosterone, which they have a pharmacy in-house. So all I technically would have had to do was walk downstairs. Doesn't do any of those things. And it wasn't until I was leaving, I was like a couple blocks away, that I got a phone call from the doctor's office saying, so sorry, I forgot to give you that prescription. It'll be here when you get back. Okay, fine. So I'm like, I'll just go back tomorrow. I'll pick it up, and they'll have my other prescription there. Great. So I go back and I get the inhaler, and I go to the pharmacy and I get the inhaler, and I'm like, I'm supposed to have 2 prescriptions. They're like, no, you only have 1 here. So it's like, so she's not even doing the things that she's supposed to be doing. So what makes me want to actually go through all the hurdles? Like, if I can't even get a competent doctor to do just what they're supposed to be doing anyways, how can I deal with all of the transphobia and all of the kind of just, it's maddening.
Yeah.
And it's really disheartening.
Yeah.
And I have to say, like, my husband and I got married 6 months ago. It was really exciting. And he started a new job, and he has health insurance, and I'm a freelancer, so I don't have a health insurance. But now I have on his health insurance, which is great. But I'm in this situation where I've been on his insurance since the beginning of February. I've not made a single fucking phone call. Because the last thing I want to do is have to go back into the system.
Yeah.
And
Tell
start
your
again.
Story all over again. Be dismissed all over again. And, that's not even to say that you necessarily would be dismissed. Every once in a while, a doctor surprises you.
Sure.
But I am going through something similar right now where, the insurance that I was on ended, and now I'm on Medicaid and like an HMO through the state. So all of the doctors that I had before don't take that insurance. All 12 or 13 of them. So now I'm in a position where I have to start all over again. And I found a primary care provider who seems wonderful. I've only seen her once, but going into that appointment was, looked like I was preparing for war. The night before, I was like getting all my records together, like making notes, and like I go a little like above and beyond, which is intimidating, I think, for a lot of medical professionals, because I come in with everything like post-it noted and annotated, like super duper organized, because I know that if I just hand them a stack of paper, they're going to be like, no, please leave. So I have to like manage the situation in a really specific way that doesn't necessarily allow for me to be the patient. Like I have to be an advocate first and a patient second. And that's not necessarily the best thing for my healthcare every single time. It would be much better if I could just go in and be like, I have a shit ton of things wrong with me. Want to hear about it?
Yeah.
And just be able to have a conversation.
Yeah.
But because I've had so many like negative experiences and so much trauma really from that, going into new doctor's appointments and scheduling new doctor's appointments and looking for new doctors, and it's just an absolute nightmare.
It really is. And I mean, it's one of those things that is, especially for people with significant, like with chronic illnesses, these like dehumanizing like experiences are tacked onto a daily onslaught of dehumanizing experiences in the world, right? Outside of the doctor's office,
and
right?
Dehumanizing experiences inside of your own body.
Exactly, right? Where you're just consistently coming up against challenge after challenge after challenge, barrier after barrier after barrier, that to then go to a place that we're supposed to be getting care and not receiving that, a place where we're like actually supposed to be able to be a little vulnerable. Like we have to take off our damn clothes, we have to let people touch and prod and poke on things that we're not supposed to have people around us, right? At any intimacy at that level, we're supposed to tell them all the things that are wrong with us, the things that hurt, the things that don't work right, which are barriers that we've learned to hold on, like to guard ourselves against the rest of the world. If they're not able to take care of us, what can we expect in the rest of the world? Yeah. Like, I don't know about you, but like I was really concerned with the first time that I had to tell my at that time new boyfriend that I think I may have to take a cane to this event. And I mean, he's a wonderful, beautiful person, so of course he was just like, great, that's fabulous. What do we need? Like, it's,
Does it have streamers?
Exactly, So like that's great, but I had to, like, the people that we have to go and engage with every single day, like the coming out process of disability, the constant discussion. Like I used to say for a long time, like I never want to meet somebody unless I have my cane with me already, because then they're not going to ask me about it.
Right.
But if I have to bring it the next day, they're going to ask me what happened, which now is a fucking story. And now it's like I've been lucky that I haven't needed it much in the last couple of months. Like much at all, except for when I travel on a plane, because pressurized cabin and swelling and unswelling
and
blah,
horrible,
blah.
horrible accommodations by airlines.
Yep, and moving and walking back and forth and back and forth, and not being on your own schedule and all that stuff. I haven't needed to use my cane that much lately, which is fabulous. But that means that at this office that I'm currently working at, there's 50 some people who know me without a cane. And I worry about the day that I have to show up with one. And there's been days where I'm like, I'm just not going to go in because I don't hurt enough to have to stay in bed. I hurt too much for having to have that discussion 50 times.
Yes, and that is such a good point. That like when you're not feeling well and you're in pain and you're sick, having to have that in-depth conversation of what happened. Oh, nothing. I just stepped on something and my toe dislocated. What? That doesn't make any sense. And then having to be like, well, I have this thing, blah, blah, blah.
Yeah.
It's just not the time. It's not the time.
Well, and people don't realize that they're actually probably the 10th person who's asked, right?
And also, it's extremely intrusive, and people have this, sense of entitlement to know what's going on with your body, which is like, excuse me, do I ask you? Well, actually, I do ask people what's going on with their bodies, but
kind of would be a weird podcast if you did it.
it would be a weird podcast if I didn't. It's true. Yeah. The last I think it was a bridal shower that I went to, I got everybody like talking about their gross pregnancy stories, which actually turned into a lovely bonding exercise.
I love it.
But like I do it in a way that I make people feel safe, and I try not to make them feel like they have to talk about things that they're not necessarily comfortable talking about with a stranger.
Sure.
Whereas other people are just like, oh, what did you do? You're too young to have that. You're
oh my God,
this,
too young.
Too
I hate that one.
Ugh.
It's like, I think about that on the subway all the freaking time. When New York City, it's hard not to think about especially about mobility. Mm-hmm. We're in a walking city.
Yeah.
We don't have cars. We travel with the stuff that we want to carry we're holding it. Mm-hmm. Up and down stairs all the damn time from subway to subway.
Well, there's no reason why I should have had to drive here today, because I live, up north of the city in the suburbs. I could just take public transit, but there's so many unexpected because I can't stand for very long, and I'll pass out. I can't walk for very long. I can't this, I can't that. And, theoretically, I should just be able to sit down on the train and take the train and then, walk a block or two. But it's never that simple. Like, the elevators in subway stations are never working. It's just a total
And even
nightmare.
if they are, it's like a urine pool at the bottom of them, so it's at least, so it may be functional and disgusting. That's the thing. It's like, I get this, and I am a white, appear able-bodied, man in my, 30s, and I actually look younger than I am, right? It's, people usually read me from my early 30s. I'm in my late 30s, like, not like significantly younger, but people don't see me as an older person, right? And when you get where like all of these things say, give your seat to a pregnant woman, the elderly, or the disabled. And I don't read as any of those three things.
Right.
So yesterday, and I also one of the things that has been helping me move more consistently is that I go to a gym now. Like, I'm actually forcing myself to work out. Even when things hurt, I'm going to do what I can, because one thing may hurt and I'll save that thing. I'll take care of my knees today. But if I move everything else out, it'll keep it from starting to hurt. Right. Maybe it'll keep, and that's one reason I haven't been needing a cane as much. But it doesn't mean that things don't hurt.
Right.
And so I was, getting out of the gym yesterday. I'm like, oh, hell, the swelling in my spine is significant. My back could go out at any moment. And when my back goes out, I am flat. Like, I will collapse on the ground and can't get up. And I'm like on the subway with this backpack and my boxing gloves. Boxing gloves being this big marker of like, I have all the ability,
right.
And I'm like hurting like hell, and a seat opens up, and I sit, and it's right by me, so I don't have to like battle anybody to get it. And I sit down, but that's when this older person gets on the train and stands right in front of me, and I can just feel this pressure and guilt, being like, I am supposed to get up for this person, and I don't know what this person's ability is. It could actually be a lot
more than you,
worse than mine,
or worse,
and
right.
It could be a lot they could be a lot stronger than me. Like, I don't know, but it's like this pressure. But because they're older, that's the marker. We can see that they fit one of these three categories.
Yeah.
Not to mention, just like I'm supposed to give up my seat up for a woman because of sexism, right? Because of women being supposedly weaker,
we
right?
We can't stand for very, very long.
Exactly.
We'll get the vapors, which actually is true of me.
Yeah, that's the thing, is that like it's this idea that just, that I'm like, I don't fit these markers of ability, and so I don't get the seat. And so then I have to stand on the train. And for me, standing is also really bad, right? Like, walking is usually a little bit easier than standing.
Yeah, because the muscles in your legs actually send the blood back up.
Yeah.
Otherwise, that's why I had to put my feet up while we're sitting here.
That's why I'm swinging my feet all the time. I remember at a meeting years ago, I was on the staff, and this boss of mine at a social justice organization, got to say, just for the record, social justice organization staffs are not always as awesome as the organization's work.
There's some problems within the progressive movement of completely and utterly ignoring ableism.
Oh, yeah. And I was moving my legs back and forth, and kind of, I was swinging my seat around, and I was just helping keep the blood flow a little bit in my back and in my knees. And eventually he just literally stops my chair, like grabs onto my chair and stops it. It's like, can you stop that? And I'm like, actually, I can't. Let me tell you why. And I have to go into this whole explanation. But it's just this thing where it's like, you're expected to stand on a subway and then walk upstairs and then walk for big periods of time. And then you come into spaces where people are expecting you to be, too old, too young to, be walking with a cane, or too young to have hurt bodies. And then they expect that now you have to explain why. I can appreciate to some extent the impetus to see like a cast on someone's arm and say, oh, what happened? But when I get the what happened, it's not actually a question I can answer, right? Like I remember getting this long conversation with somebody who's like, why do you get so frustrated by that question? I'm like, well, because A, it's not the first time I've gotten it. B, it's because I can't actually ever answer that question because it's a question that assumes the wrong thing. It assumes able-bodiedness and that as of this moment, something changed. And that it happened, that a thing happened, as opposed to this is a condition or this is me. I also get the question, are you okay? And the answer that I'm like, well, first off, on what sphere are you asking this question?
Can you be a little bit more specific?
So a lot of times when I don't want to answer them, I just say yes. And then I just keep talking about other things. I'm like, if you're going to ask me that, I don't want to talk to you. If someone really wants to get into conversation, I'm like, look, I got a lot of shit going on. And a lot of times, my most painful moments aren't things you're going to see.
We have in our culture such a specific, incorrect idea about what a disabled person looks like, and the vast majority of disabled people do not conform to that image. I mean, even most wheelchair users are not full-time wheelchair users, but if you're not in a wheelchair forever at all times, you're not disabled.
Exactly. Or you're working the system, which is another,
Oh, don't even get me started on that one. Do you have any idea how hard the system is? Do you have any idea? I just this week finally submitted my application for disability. I left my job a year ago, and it's taken me this long to finally do it and get it in because, first of all, it's a pain in the ass. It's not particularly accessible for people who have a hard time sitting on the computer for any length of time. Although I did just talk to somebody in the UK last week, and their application is 50 pages long and entirely on paper. So we at least have that advantage. But also, sometimes my most productive hours are in the middle of the night because my sleep phase is off. But the website goes offline after 11 p.m. for maintenance.
What? Every night?
Every night that I tried, it was like, oh, sorry, check back again later.
What?
Yeah. So I could have gotten it done much more quickly if it was available during the time frame that is most productive for me.
Yeah, and so that's navigate. This is one of those things where it's like when I'm working with, because I work on issues of diversity, inclusion, and equity, which is essentially to say, I talk to people a lot about power, privilege, and oppression. That's my whole job.
You must be busy lately.
Yeah, because oppression just started.
Right.
Luckily,
people just found out about it.
Yeah, exactly right. It's we're finally getting to the place where people are wanting to have more conversations, which is great.
It's definitely a good thing. It's just a little cartoonish now.
It is. It's we Columbus racism. But I'm always in this space where I'm supposed to be opening people's consciousness about the way that oppression plays out. And people, at least, the spaces that I'm in, the groups that I'm working with, at least know that racism is a thing, right? They can understand, even if they're only understanding it in pre-civil rights stuff, right? They might understand that sexism is a thing, even if they understand it in 1960s style sexism, right? pre women's movement stuff. They might understand heterosexism. They may understand issues around immigration. But when it comes to ableism,
forget it.
And the language is so strong. And when I start to talk to people about how we are respectful of our bodies, of each other's bodies, it usually goes beyond people. Like it goes from like expanding people's consciousness to like throwing a nuclear keg in the middle of it and letting things explode because people just can't understand all that stuff.
Yeah. People don't like to talk about ableism and get so upset when you bring up ableism because they don't want to feel like they've done something wrong and they were ableist. And I'm like, yeah.
Exactly that.
That doesn't mean it's not ableist.
Mm-hmm. Yeah. I mean, so that's the thing, I'm glad you brought that up because I think that that's something that I come up with all the time. That one of the biggest hurdles to people actually uncovering their internalized kind of oppressor is the fear and worry of being seen as fallible. Mm-hmm. And we, especially in the United States, have this real strong
we were chosen
urge,
by God,
right? Like there's a myth of individualism,
mm-hmm.
right? That we live as individual things that are completely unique to everything else, that is not impacted by other things, but that we are like completely autonomous. That if we are really good, we will do all of this work by ourselves and succeed by ourselves, mm-hmm. and we will be better than other people. But we don't need other people. We can do it all on our own. One person pulling themselves up by their bootstraps. Yeah. It's already an ableist story.
Which is so nonsense because if you use roads, like that just
Sure.
blows that whole thing up.
Sure. I mean, if you talk to another person, like we don't live in a vacuum. We are always the culture that is created is always in reflection and in response to everything we've ever known and every person we've ever talked to and every image we've ever seen. But this idea that we like are these, these completely autonomous and separate beings that move through space, that means that like what we think and what we intend is way more important than the impact it has on other people.
Right.
And so when I'm in these workshops that I do, like I'm always working with people to try to get them to understand the difference between intent and impact, mm-hmm. and the relationship between the two, mm-hmm. Because there's so much discrepancy between them. And most people do not want to be jerks, right? They're not ableist because they're like, I really hate all those disabled people, right?
Although those people exist.
They do exist. I will definitely acknowledge that those people exist and do not want to deny people their real and true lived experiences of having to battle those assholes because they exist. But there are people, like most of the people in the world, like think that they're good people, mm-hmm. and they actually kind of are like, oh yeah, like, I don't want to be a bad person. I don't want to hurt somebody's feelings. But they don't realize that A, they're doing it, and by not getting the information, you're actually even more apt to do it. Mm-hmm. And because we are always trying to guard ourselves, are always working to guard ourselves against being seen as fallible, we can never actually get to the point where we can actually become better, mm-hmm. because we're not willing to accept criticism. Mm-hmm.
Which, like, if we just quickly jump back to your story about that doctor, that mm-hmm. is, you pointed out that, like, the way that she approached the situation was not particularly helpful for you, and here's a way that we can move forward that might be a little bit better for both of us, and she just shut down.
Mm-hmm. She shut down, and she continued to shut me down, right? And so if her intent was care, she did not have that impact on me. She can say everything about every intention that she had. That's great. And it's great to know that she wasn't intending to do me harm.
Right.
But that the impact that it had on me was not careful.
Uh-huh.
I did not feel cared for. I did not experience anything that actually resembled care by the end of that. And so maybe I'm just oversensitive, but it doesn't matter. Like her intent is so disconnected from the impact, then something's wrong. Mm-hmm. And one of the things that I can do as an individual is say, okay, well, I should just not worry about how it impacted me, which is usually the expectation. Mm-hmm. And so people who have disabilities in the United States, like not just in the United States, in the world, but I talk about, U.S. culture a lot. Because, hey, it's the country I live in, that we're always expected to just brush off the impact. But when you have a disability, the brush off doesn't happen so easily. Because a lot of that stuff wears on our bodies. Mm-hmm. It wears on our minds.
And it's cumulative.
Exactly. Exactly.
The effect of it is cumulative, and like we were already talking about, to have to explain to 10 different people in one day what's wrong when that is not a simple answer is exhausting.
So one of the things that I've talked to people about before with this is that first off, like, if you, do you, like, I'll ask people, do you think that being in a stressful situation can be as exhausting as doing some sort of physical workout? And most people say, yeah, like, when you're really stressed out at work, like you come home tired every single day. And if you're not as stressed, that you may not be as exhausted. So you come home tired every single day. And if you were, lifting weights or running, on the treadmill, you may come home exhausted every day, right? So they can equate that, like, stress can actually cause, like, a physical reaction to it. Like, we can understand that. Okay, great. And then I say, like, if you're coming up against a challenge every single day that continues to be stressful, could we say that would be the equivalent of every single time you walk, like every time you get up from your couch, you have to lift up a big weight and move it, and then go to the bathroom and then come back and lift a big weight and put it back down again. Like, that would eventually become cumulatively difficult. And you would be more tired from that exertion. If you have to do that every single day of your life, it wears on the psyche. We eventually get broken down to saying, don't want to interact with other people. I don't want to talk to people about this at all. I don't want to deal with it. I don't want to go to that space because I'm going to have to fight. I mean, I can't tell you, like, for the last couple of years, I have not been going to events. I used to go to these events all the time. And then I realized, like, I'm going to fight for a chair. I'm going to get there early to get a chair. I'm going to explain to people why I need the chair and they don't need the chair, and to get the heck out of the chair. I went to an event to support a friend recently, and I didn't realize it was going to be as crowded as it was. And it was packed. It was standing room only. And I set my bag down, and I'm just like, okay, I think I'm going to be sitting on my bag in the back of the room. And then actually what I ended up doing is saying, I'm going to actually just get a drink and just tell my friend it was great to see you, and not actually watch the event. Yeah. Because I can't do it. Yeah. It was great because at the break, when I told him, like, I'm sorry I wasn't able to really see it, I couldn't find a seat, and I just wasn't feeling that great to stand the entire time. And he apologized and made sure to find me a seat, which was great that I had an advocate, an ally that was willing to support and help me in that moment. But I know that I have the will, like, I have, like, an understanding that I can go up to somebody and say, can I please have this seat? I actually need a seat. Like, that is a possibility. My psyche was not going to allow it because I was tired. Right. And it wasn't tired because of the times that day that happened. Right. I was tired because of a lifetime of experiences of having to deal with people roll their eyes or grit their teeth at me.
All of this without even acknowledging fatigue from your actual physical condition, or if you have a condition that impacts your ability to communicate in however many different ways that can manifest. It's just, there's so many things.
Yeah.
Well, thank you so much for talking to me. This was great.
Yeah, I've had a really great time. It's been a great conversation. Good. Thanks for chatting with me.
Yeah.
Thanks for listening to In Sickness and in Health. Find resources and more from us at insicknesspod.com and on social media at insicknesspod. Check out today's bonus episode where we talk about intersectionality, the spectrum of ability and access, disclosure, hormones, and the potential for allyship between the trans and disability communities. And don't forget to be excellent to yourselves and each other.